Hi and welcome back to Clients and Revive. I'm Dr. Rob and today's video is about something that's easy to overlook, but crucial to your health: 9 warning signs that your kidneys might be failing, and what you can do to avoid dialysis. Did you know that over 88,000 people in the US are living with end-stage kidney disease, ESKD, also known as kidney failure? At this point, your kidneys stop working well enough to keep you alive without treatment, and your options are limited, either a kidney transplant or dialysis. Both of these come with major challenges. There are over 100,000 people on the transplant waiting list, and more than 70% of people with kidney failure depend on dialysis just to survive. Now, imagine what that kind of treatment costs: $40,000 a year or more, and that's just for dialysis alone. Here's the thing: kidney disease doesn't happen overnight. It creeps up slowly, often without any clear signs at first. That's why recognizing the early symptoms and getting tested is so important. You don't want to wait until it's too late. The good news? We're here to help you understand the warning signs so you can take action before things get worse. What exactly is kidney failure? Your kidneys act as the body's natural filter, cleaning out the waste and extra fluids from your blood. But when they start to fail, these toxins build up, and your body struggles to cope. Kidney failure is most common in people who have other health conditions, like high blood pressure, diabetes, or heart disease. But here's a fact you might not know: kidney disease is often silent. People don't feel it happening, and by the time symptoms show up, a lot of damage has already been done. The scary part is that most of us think we know if something was wrong with our kidneys. We assume we'll feel pain or notice changes in our urine. But the truth? Kidney failure doesn't work that way. Often, there are subtle changes happening that we brush off or explain away. So how do you know if your kidneys are in trouble? Let's dive into the 9 warning signs you should look out for. Constant fatigue. More than just being tired. Everyone feels tired sometimes. But if you're constantly feeling exhausted, even after a good night's sleep, there could be more going on. When your kidneys aren't filtering waste properly, toxins start to build up in your blood, making you feel sluggish. You might feel like you've hit a wall, even with simple tasks like walking upstairs or carrying groceries. Imagine trying to go through your day with weights strapped to your body. That's how it feels when your kidneys stop filtering out all the bad stuff. Your energy tanks because your body is literally running on fumes. And let's not forget, your kidneys are responsible for making a hormone that helps produce red blood cells. Without enough red blood cells, you can become anemic, which makes you feel even worse. Tip: start small with gentle exercises, like walking or yoga. It can help with the fatigue. Yes, even if it feels hard at first, it's worth it in the long run. Muscle cramps. More than just a little twitch. We've all had muscle cramps after a workout or during a bad night's sleep. But if your legs are cramping frequently for no apparent reason, it could be a sign of electrolyte imbalances caused by kidney disease. Think about it: your kidneys regulate things like calcium, potassium, and sodium. When they're not working right, your muscles suffer, leading to painful spasms. For example, some people on dialysis complain about waking up in the middle of the night with cramps so bad they can't get back to sleep. That's not just inconvenient, it's a warning sign that your electrolyte levels are out of whack. If you're experiencing these cramps regularly, don't just chalk it up to old age or too much exercise. It could be your kidneys trying to tell you something. Tip: make sure to stay hydrated and talk to your doctor about adjusting your electrolyte intake. Sometimes it's as simple as tweaking your diet to balance things out. Swelling or edema. You may notice it in your ankles first. One of the most telltale signs of kidney issues is swelling, particularly in your ankles, legs, or feet. Picture this: you've had a long day at work, and when you take off your shoes, your ankles are noticeably swollen. It's not just because you've been sitting or standing for too long. This can be a result of fluid buildup in your tissues. When your kidneys don't filter out excess salt and water, it stays in your body, causing edema. People often mistake this kind of swelling for other issues, like poor circulation or heart problems. But your kidneys play a key role in keeping fluid levels balanced. Reducing your salt intake can help, but if the swelling persists, it's a good idea to get checked out by a doctor. Loss of appetite. It's more serious than you think. We all lose our appetite from time to time, especially when stressed or not feeling well. But if you notice that you're consistently eating less and you're not sure why, this could be another red flag. Toxins building up in the bloodstream can dull your appetite, and over time, it can become a vicious cycle. You eat less, your body gets weaker, and the kidney disease worsens. Some people describe feeling full all the time, even when they haven't eaten much. Others might experience nausea or vomiting after meals. It's easy to brush off as indigestion or an upset stomach, but persistent loss of appetite can signal something more serious. Tip: if you're struggling to eat, try smaller, more frequent meals and stay hydrated. Nutritional shakes or smoothies can be helpful when you just can't face solid food. Itchy skin. It's not just dry skin. Persistent itching is a symptom many kidney patients don't expect. If your skin feels itchy all the time, especially if you're scratching until you're sore, it could be a sign that your kidneys aren't removing toxins properly. This buildup of waste can affect your skin's health, leading to dryness, irritation, and even sores. Here's a story. A patient once described how they thought their intense itching was due to a skin allergy. They tried changing soaps, lotions, and even their laundry detergent, but no matter what they did, the itching wouldn't go away. Only later did they find out it was related to their kidney function. Tip: use a good moisturizer and avoid hot showers, which can dry out your skin even more. And if the itching persists, definitely talk to your doctor about adjusting your treatment. Shortness of breath: it's not just in your head. Feeling out of breath after climbing a flight of stairs or even just sitting still can be terrifying. When your kidneys aren't functioning properly, fluid can build up in your lungs or cause anemia, both of which make it harder to breathe. It's like your body is struggling for oxygen, even when you're doing nothing physically demanding. Memory fog and confusion: it's easy to forget things here and there, but if you're having serious trouble concentrating, remembering things, or making decisions, it could be linked to your kidneys. When waste products build up in your blood, they can affect your brain, leading to memory problems and confusion. Bad breath or a metallic taste: if your breath smells like ammonia or urine, or you're dealing with a metallic taste in your mouth, these are classic signs of uremia, the waste that your kidneys aren't filtering out. It's not just an embarrassing problem, it's a sign that your kidneys are struggling to do their job. Skin discoloration: your skin may also change color, turning pale or yellowish as a result of kidney failure. The accumulation of waste gives the skin this unnatural tone, and some people also experience darkening of the skin due to hormonal changes. Practical tests and solutions: if you notice any of these symptoms, the next step is simple: get tested. Common tests include measuring your creatinine levels, checking for protein in your urine, and getting an ultrasound to see how your kidneys are functioning. In conclusion, recognizing these signs early and acting on them can make a huge difference in managing kidney disease. The earlier you detect kidney problems, the more you can do to slow down the damage. Whether it's through lifestyle changes, medications, or medical treatments like dialysis, there are options. And remember, your doctor is your best ally in this journey. Thank you for watching Cleansa and Revive. Don't forget to hit that subscribe button and turn on notifications so you don't miss our next video. See you next time. Stay informed, stay healthy.